Good morning, everybody. Thanks so much for listening in. My name is Justin Nelson. I'm the Senior Vice President at Gyant. I want to start a little bit differently than the last gentleman did. Maybe talking a little bit about the old normal for a second. For a lot of us that have interacted with the healthcare system in the United States, this is a real life story. Happened to me about 8 months ago. Came home from work and the next morning got up. My wife's in retail, so she had to be out the door pretty early for holiday sales, and my daughter was ill. So I did what any hip modern dad would do. I got on my phone, looked around here in Denver to try to find some healthcare options. Essentially what I found is some hours and locations, but not really what to do with my daughter that was presenting with some fevers and some chills. So I put my phone down, got my computer out, got the exact same scenario, and now kind of confused, not sure what to do. Picked up the phone, called the pediatrician. For those of you who have children, y'all know that not a lot of pediatricians open at 6:30 in the morning. Left a message. Starting to get a little panicked, not sure what to do. Get in the car, drive over to urgent care. Apparently everybody in Denver is sick that day, or certainly in South Denver, because the wait time is over 2 hours in the old normal at the urgent care. And in that scenario also, there was not a pediatric specialist available. So I got my daughter there. She's starting to get pretty upset, and top of not feeling well. Now she's upset because we don't know what to do. So dad's starting to cry a little bit too. We jump back in the car and we do the one thing that no healthcare system in this country wants us to do, which is to rock up into the ED at the local hospital to try to get care. So after a couple more hours, we essentially find out my daughter's got some seasonal allergies. She's prescribed a histamine, and we're off and running. 4+ hours, multiple hundreds of dollars for me and my insurance company, and as a general rule, pretty low satisfaction. I think maybe this story resonates for a number of you, whether you have children or not, but maybe you've experienced something like this. What we have done at Gyant is attempted to fix that, to build a solution that takes that previous experience that I showed you that has a lot of friction in it, multiple stops, lots of frustrations, lots of crying, lots of cars, etc., and adapt it to the new normal, which is to give hospitals and healthcare systems a tool set which can turn episodic and oftentimes isolated care interactions into long-term personalized relationships which create loyalty amongst your existing patients and allow you to attract and retain new consumers, all the while delivering better health outcomes. And an additional benefit to this, having a solution like ours helps you expose and fix the existing inefficiencies so that clinicians will have more time to do what they went to school to do, and which is their core mission, which is to practice medicine. So if you imagine a Gyant solution on that same scenario, it looks much more like this. Same sick daughter, but instead I go to a modality that I like, which is my mobile device, and I very quickly am welcomed to the health system by an empathetic human-like interface. Talks to me, how can I help you? What are you here for today? I go through some question and answers in a clinically validated protocol, find out the best solution really is to get in line and do a virtual visit with a pediatrician. So I'm immediately taken to that virtual visit platform. A couple minutes later, the pediatrician shows up, talks to my daughter, talks to me over video, find out that my daughter has seasonal allergies, gets drugs prescribed, and we're done. As an added benefit, the next day I get an SMS message saying from the health system, making sure that I understood my post-discharge instructions and make sure my daughter was okay. Scenario number 2, no car, no ED, no urgent care, and to a lesser degree, no crying daughter and dad. I'm in the deal now for less than an hour. I haven't left my house. Probably cost me about $49, and my overall satisfaction is 9 out of 10. This is the Gyant journey. This is the new normal. So for a lot of health systems, they're focused in that middle, which is, hey, how can I enable things like virtual video visits or asynchronous visits, all of which is fantastic. How do I do that? But the key is really, how do I bring that together? What is a common platform that enables me to take advantage of all of the things that I've invested in to adapt to COVID in the new normal? How do I do that? And that's where Gyant comes in. We insert ourselves there so all that money and energy and effort you've spent to get consumers to want to interact with you when they have a clinical need is dealt with appropriately. We do concierge So we do clinical and non-clinical service. If it's a clinical complaint, we go through a triage process, 68 adult, 22 pediatric protocols, with the objective being find out what's wrong enough to get the patient navigated, the consumer navigated, to a service delivery, to a care venue that you as the system control. So we do concierge for clinical and non-clinical, find out what's wrong, try to understand why you're there. If it's a clinical issue, we triage you as a consumer and then navigate you and drop you off virtually or physically to the right care venue. So all those investments you've made in service delivery, whether that be self-care or a nurse call line or telemedicine, virtual, all the things that you see there, even up to and including urgent care and emergency care, you're able to take this consumer and route that person to the right venue of care simply and easily, all within an experience, all within a modality that they want without jumping around. Why would you want to do that? Quite simply, there are 3 reasons. Number 1, you do not force your patients to self-diagnose and then worse, or equally worse, pick their venue of care. So what we do is allow you to give the patients the ability to go through a process of triage, make sure then that the venue of care that's selected or that they select really meets their needs. What you don't want is me showing up at the ED with a sick daughter. What you want is me showing up on a virtual video visit with a pediatrician. So don't force your patients to self-diagnose. Don't force your patients to understand where they should interact with you. 2, give your patients an experience on a modality that they want that's friendly and easy, handles a full range of issues from clinical to non-clinical, operates all the time so that you don't have to have a call center up and running all the time. We never go to sleep. Give them the ability to escalate to humans where necessary, works for both your employees and your consumer base. And finally, reason number 3 why you would do this is it frees up your providers to practice medicine. We have solutions that allow you to reduce the documentation by pre-population of notes in the EHR, pushes more folks to appropriate investments such as virtual video visits or virtual asynchronous visits, and then finally gives you the ability to help predict, not predict, but react to the next big thing that could occur, like a spike in COVID cases. Close up there a little bit. As Razu said in a presentation 2 ago, there is no better time to serve. We agree 100%. We look forward to working with folks to help give their consumers back the ability to go to the right venue of care in a safe and an efficient manner.
Great pitch. Justin, I'm going to tell you that resonated. That resonated with me just as a user of healthcare for sure. And I will tell you one thing, if it can prevent my wife from self-diagnosing, I'm a big fan of literally last week, after immense research, she was 100% convinced she had a brain-eating amoeba. 100%. Yes. I mean, yes. But that's the world we live in today. I guess my quick question to you first, and then we'll do a lightning round with a couple of these others, is it almost sounds too good to be true. And this is coming from a guy who doesn't understand the back-end plumbing of healthcare, but I understand an element in fintech startups and innovators that I see, which is I can make the front end look real pretty, but if it sits atop something where essentially that plumbing is designed for an old model, can this still work?
Yeah, absolutely. So what we've done is we've built the triage protocols to get to a differential diagnosis. And that typically means the first, second, or third most likely condition that the patient has based on presentation. So our objective is to get that differential diagnosis, and then we technologically present it to the system, and through our configuration engine say, if it is an upper respiratory infection of mild duration but medium severity, where do you want to send that? And so that's that configuration that allows you to say, hey, the best place for that is a virtual video visit, or the best thing for that is to call into nurse triage, or to serve up an urgent care in the closest one. So where the patients, where those consumers are sent is entirely determined and configured by the healthcare system, so that you route the patients to the right place. We just give you the differential diagnosis.
Another question from the audience now. Similarly to the last company, can you share more about your founder's experience outside healthcare and how that has helped you design better user experiences in healthcare?
Fantastic. Yes. So the two founders actually didn't come from healthcare. The staff came from healthcare. Guys like me have been in healthcare, but the two founders came from video games. And you say, well, in consumer selling. So you say, why is that important? It gives us the benefit of being a very consumer first, consumer friendly, and mobile first experience. Right? Exactly. They came from making video games, man. So if you know how to make video games and you know how to market to consumers and keep consumers engaged, then you're able to produce a solution that's going to keep healthcare consumers engaged to get them to where they are then navigated to the best system resource for care. So we take a very consumer first approach in the way that the product is designed.
That question was from Lindsay from Adrian. I'm assuming she's met you before. That was a real perfect teed up question and a great answer that wove in with the rest of our stuff. All right, lightning round. Are you ready?
Yes, sir.
Lightning round. You know what it is, right?
Yep.
Which geographic regions are you present in, and what's your roadmap for expansion?
We're in every geographic region in the United States. We're going to, for now, stay in the United States for a whole bunch of reasons, but we like mostly data privacy. So we're going to stay in the United States for now.
How has COVID-19 affected your product?
Fantastic. It's accelerated people's need, healthcare systems need to put a front door in place, to put something there because they've invested all this money in virtual care options such as telehealth, but don't really have a great mechanism to get people routed to there and make sure that that's the right mechanism for people. They're still making folks self-diagnose and self-select. COVID has accelerated the need for a front door, or the recognition for a front door.